Good morning, everyone. My name is Susan, and I'm very excited and happy to see you this morning. Thank you for joining us this morning. I'm also very happy to see Dr. Neil again. Dr. Neil, welcome back to Expat Living Talks. Dr. Neil Forrester is one of the amazing doctors at Osler Health, and he is coming with us from his Star Vista Clinic. And this morning we're going to talk about Teen Talk. So, Dr. Neil, are you there? Can you join us? I'll hand it over to you.
I hope
There's
everyone
some music
can hear me.
going on.
Yeah, the music's not me. Don't worry.
Yeah. Okay. There we go.
Everyone will mute themselves. Hello, everyone. Thanks for joining us this morning. Nice to see so many people. People are still coming in from the waiting room, but we're gonna crack on. Susan has moderated some of my talks before and is really good at sort of fielding your questions. So feel free to type in questions into the chat as we go along. I'll try and answer as many of those as we can during the talk, but then there will be time at the end for a more formal sort of question and answer bit. So don't worry if I don't get to it during the talk. So I'm going to talk about teen health this morning, trying to cover all aspects of teen health, the mental, physical, and sexual aspects. So that's a lot to get in, and we could go on for days talking about that. But I'm going to try and give you the key points and hopefully give you a bit of a framework to help you think about your children's health. I'm going to talk about the physical side of things first, then talk about sexual health, and finally coming to mental health, which in teenagers is quite a big topic, and I'm sure a reason that many of you are here this morning. Normal teen development, and I'm going to keep using the word teen because that's the name of the talk. I'll sometimes use it interchangeably with adolescent, because really, the teens are a number. Teenage years start at 13, but adolescence starts quite a bit younger than that. Average age of onset of puberty in girls is 10, in boys is 11 or 12. And we don't actually consider that puberty has started abnormally early in girls until it starts younger than 8. So these things sort of creep up on us at a much younger age than we expect. And really, we should be thinking about adolescence starting from about 10 years old and upwards. And of course, different children mature and develop at very different rates. And that in itself can be distressing for some kids. If you look or sound or feel very different to everyone else in your class, even though that's completely normal, that can be a challenge for a lot of the kids I see. The changes that are going on, clearly with puberty, massive changes to the body and the physical self, lots of mental and emotional changes. It's that transition from childhood into adulthood and the tension that causes within individuals and families. Your kids are becoming less dependent on you for everything they need, and they're developing more relationships with people outside the family unit, and those relationships are becoming more important to them. And of course, sexual development. So both the physical sexual development that happens with puberty, working out one's sexual identity, and having one's first sexual relationships are all things that can happen in these years. So we'll start just talking a little bit about the physical side of things. The teenage years are really, for many kids, the first time that you actually have to teach them to be healthy and show them to be healthy. So in early childhood, when your kids are sort of 5, 6, 7-year-olds like mine are, they have to eat what you tell them to eat. They don't always get along with it, but you're in full control of 3 meals a day. They often don't have to do formal physical exercise. Most kids under 10 don't have to think about keeping fit. They just run around, they do stuff that they enjoy, and that keeps a lot of them in good shape. They don't have access to personal devices, or they shouldn't have access to personal devices at a very young age. So you're more in control of their their screen time. And this all changes in the teenage years. They probably will have their own phone. They probably will make more of their own meal choices, whether that's at school or when they're out with their friends without you. And so, it's really a time in their life where if you can form healthy habits and set some good examples at this age, then that's going to carry through for the rest of their lives. When I was at medical school, we were taught that type 2 diabetes was an adult disease and type 1 diabetes happened in children. Sadly, that's not the case anymore. And in the UK, where I'm from, around a third of 10 and 11-year-olds are overweight or obese. And increasingly, we see type 2 diabetes in children. So, that's really something that we should be aware of and trying to put things in place at a young age to stop that from happening. Eating disorders is mentioned on this slide, but I'm going to talk a bit more about eating disorders when we get to the mental health part of the topic. So what can you do as a parent? Well, keep it simple. Ultimately, you should be in control of their screen time when they're at home. So, an easy step is no phones in the bedroom after bedtime. That the phones are left elsewhere in the house to be charged at night. Eat as many meals as they can at home, ideally as a family. Eat whole, real foods. Try and limit processed foods, sodas. Sports drinks is a big one in teenagers. They're sort of marketed as something that's either healthy or helps performance, and they're really not. And caffeine intake. So there's an age that lots of children have their first introduction to caffeine, and a lot of these commercially available drinks are really loaded with too much caffeine, and we don't think that's particularly healthy for kids. Before I talk about alcohol, I'm just going to touch on a few, while we're on the physical health part of the talk. There are some physical conditions which are either exclusive to teenagers or much more common that we see. Acne, in terms of skin conditions, heavy or problematic periods in teenage girls is another common one. ADHD would be another one that I see a lot of. It tends to happen in kids at a younger age, but it's often in the teenage years where it's picked up in schools because the academic demands being placed on kids as they get older are higher. So those are things that we have treatments for, we can help with. And so, I would encourage you, if your child has acne and it's particularly distressing to them, or it's bothering them, or it's bothering you, you come in and see the doctor. Those are things that are, often get better with time as you come out of the teenage years, but it doesn't mean that we can't do anything about them, and you just have to accept it as part of teenage life. Talking about diet brings me on to talking about alcohol. So I think there's a lot of sleep lost amongst parents about their children using drugs, and we're going to talk about drugs a little bit as well. But by still, the most commonly abused drug in teenagers is alcohol. And it's often consumed in a very unhealthy way. So it's consumed all in one go in binges, often at the weekend. And the problem in teenagers is mainly the issues that alcohol consumption leads onto. Very few teenagers that I see are consuming enough alcohol for it to be directly detrimental to their health. They're not damaging their livers. They're not getting alcohol poisoning or anything like that. But their alcohol consumption is leading on to other things. It leads on to more risky behaviors. It leads to more problems with mental health. It can get you on the wrong side of the law if you do something stupid after you've consumed alcohol, particularly in Singapore. It leads to more school absence, and it leads to more accidents, both accidental death in the worst cases, but other accidents that require hospital and medical attention. And so, that's something that as a parent, I think it's quite individual and it's quite cultural, our approaches to alcohol, and everyone has their own take on when it's appropriate to start consuming alcohol, if it's appropriate, and in what sort of way. But, I think some recognizing that this is something that your kids is going to be exposed to, talking to them about it, educating them on the dangers, and ultimately limiting their access if that's what it comes to are all important things. Smoking, alcohol often go together. This slide should be called vaping and smoking. As most of you will probably already know, vaping is against the law in Singapore. And I know that a number of the international schools here have had issues with some of their teenage students being caught vaping. And it is increasingly popular amongst teenagers here as a thing to do, despite the fact that it can get you in a lot of trouble. That's a difficult one because in a lot of Western countries, a parent that found out their child was vaping would probably be relieved to discover that they weren't smoking cigarettes. So you have this sort of almost the opposite going on in Singapore. Whether vaping is unhealthy or not, whether it's preferable to smoking or not, is a whole other debate. And I'm not going to get into a talk on the rights and the wrongs of vaping here. The main issue is that it's illegal and it could get you and your family kicked out of the country if in a worst case scenario. So making the kids aware of that is very important. Smoking is also illegal under 21 years of age, so that can actually land you in quite a lot of trouble as well. Of all the things I'm going to talk about today, smoking is pretty much the worst thing you can do for your physical health. Apologies to any smokers who have joined the chat this morning, but it just is. The good news is, for parents, it's relatively difficult for your kids to hide from you. It's not impossible, but compared to some of the other stuff we're talking about, cigarettes smell. Smoking requires some paraphernalia. It requires cigarettes. It requires cigarette lighters, that kind of thing. So although it is possible to hide, most of us will get a sort of a vibe or a feeling if our children are smoking. And I think there are a few things in this talk that are all or nothing, and smoking for me is one of them. Young people have smoked since smoking was invented, but they shouldn't do, and it's really bad for them. And your policy should really be zero tolerance on these things. On alcohol, we could have a conversation about, introducing younger people to alcohol in a healthy way. There is no healthy way to introduce your kids to smoking. It's just really bad for them. It's important to recognize that some young people will need help to quit smoking. Smoking's addictive. It's not easy to quit once you're addicted to nicotine. And so some teenagers may need to come and see a doctor for assistance with that in the same way that adults do. So just telling them to stop or confiscating their cigarettes or their money might not be enough. They might actually need some sort of medical assistance with helping them stop smoking. Drugs, I think, is a hot topic for all parents all over the world of teenagers. And I think it's loaded with even more danger in Singapore. That you have both the fear of your child being exposed to illicit drugs and also the fear of what might happen to them in Singapore as a country that has such a strict zero tolerance policy on recreational drugs. Sadly, just because drug use is far less common in Singapore and far more severely punished doesn't mean that it isn't happening. And many of you will have heard stories and read things in the newspapers here of drugs being seized, of young people being caught with drugs in Singapore and punished quite severely. Certainly in most Western countries, it's still a big problem. Around 10% of teenagers in the UK have tried hard drugs. By that, we mean things beyond cannabis. So that's quite a high level, and it increases through the teenage years. The penalties in Singapore, as you don't need me to tell you, are very severe, and drug testing in Singapore can be imposed on you. You don't have the right not to be tested for drugs. And there are schools here that run drug testing for their students. And if a person is arrested in Singapore, even if it's not related to a drug offense, they can be asked to provide a drug test and punished accordingly. Again, telling your kids not to do it and confiscating things from them or not letting them go out might not be enough. They might need to speak to someone professionally about that. And I think drugs is one of the areas where parents are understandably anxious that, you know, if you come to see a doctor to talk about drugs, or if you go to see a psychologist or a therapist, are they going to break confidentiality and tell the authorities or report you to the police? I can reassure you that that's not the case. So we have a duty to report crimes and to report someone who is in ongoing danger. If someone comes to us to seek help, so someone's addicted to drugs or someone's been taking drugs or addicted to alcohol, and they're looking for help to end that or to find a way through that, then that's not something we have to report. We can work with patients to treat those addictions without having to report them to the police. So I want to give you that sort of reassurance that we don't have to report you if you come in to talk about these things. So what can you do as a parent? A common theme of this talk is you can't follow your kids around all day, every day, constantly monitoring their behavior. So you have to find, part of the challenge of parenting teenagers is to give them enough of a leash to make their own decisions and to still be in overall charge of the rules. So first of all, talk to your kids about these things, have an open conversation about them. Show that you understand that these things are out there and that the temptations are there, and that you're someone that if they need to, they can talk to about this stuff. Set rules. So when we're talking about drugs and alcohol, most of this stuff happens outside of school time, in their recreational time, often at the weekends when they're out with their friends. So they need a time when they need to be home by. They need to text you to let you know that they're safe. And there needs to be some consequences of them breaking these rules, whether you go for the carrot or the stick approach, you know, whether it's them not getting their money or their allowance that month, or not getting the clothes they want, or not getting the phone they wanted, or if it's a punishment like, well, next weekend you can't go out of the house and you have to stay in, or you have to do something else. So try and be in control and of enforcing the rules. Try and know who their friends are, know who they're hanging out with, and give them opportunities to find different activities and different things to do if you don't approve of who they are hanging out with. And ask for help if you're struggling. You know, ultimately, lots of parents find that they reach a complete impasse with their teenagers, and that's often when they come to see me, or they bring their kid to see me. But it doesn't have to be the GP. It could be friends, family. It could be a psychologist. But you know, ask for help if you find that you've run out of options. You don't have to do this completely on your own. I'm going to move on now to sexual health. Susan, please interrupt me if there are any specific questions coming up on the back of that physical health, but I will pause for questions again later on.
Okay.
Sexual health, it's one of those areas of parenting that we'd really rather not talk about if we didn't have to. No one really wants to have this conversation with their kids, and no one wants to think of their kids' sexual development too much, but it's going to happen. And so you know, we need to be talking about it, and we need to be thinking about it. The slide that I've got up there just gives you a few, sorry, they're UK biased, but a few facts there. Kids, teenagers, adolescents aren't having, we don't think, more sex than their parents' generation. Teenage pregnancies in many countries are at their lowest rate. And although sexually transmitted infections are relatively more common in younger people, again, their rates are not necessarily higher than previous generations. So our kids are not behaving particularly recklessly in that regard compared to our generation. It's true that the vast majority of pregnancies in women under 20 were not planned, were not intended. And so, you know, rather than banning our kids from discovering sex or thinking that we can control it for the rest of our lives, a lot of this is about allowing them to develop at their own pace and in their own way and in a safe way. And so you as the parent being in control of that narrative is the way to go. The teenage years are when most young people work out their sexual identity, and we know this is changing a little bit. Not so much that people's sexual identities are changing, but the way that young people express those and the willingness of young people to not really label themselves in traditional terms is increasing. The reason it's important is because, sadly, although we've achieved a lot in terms of equality and openness about people with different sexual identities, it's still certainly true that gay, lesbian, bisexual, transsexual, transgender people are more likely to run into problems in their school years. So they're more likely to miss school. They're more likely to attempt self-harm or suicide. They're more likely to be bullied. And that hasn't really changed over the years. And so if you've got a kid that falls into one of these categories, you need to be more alert to the fact that they might be at heightened risk. If your kid doesn't fall into one of these categories, we should be enlightening them about this so that they aren't the bully or they aren't the reason that other parents are concerned for their kids' safety. So again, I you know, lots of kids don't want to talk to their parents about their sexual identity, and I understand that. But the reason a lot of kids don't want to talk about their parents about this is because they're fearful of being judged. They're fearful of the repercussions or the response. And so I think it's on us as parents to create an environment where kids can be more open about this. I can't talk about sexual health without talking about pornography. And I think this is, I started the sexual health segment saying, you know, not much has changed in terms of how much kids are having sex. This is something that has changed hugely in the past 10 to 15 years. The advent of the internet has made pornography very widely available, and teenagers are accessing it at younger and younger ages and at increasing rates. So we think around a third of boys by age 10 have been exposed either deliberately or accidentally to pornography online, which is not a nice thing. And the problem with that is that pornography risks becoming the sexual narrative for your kids. And it's a very unhealthy one. I would put this along with smoking in that there is no healthy way to introduce your kids to this. There is, you know, this is, you know, it exists in the world and we can't deny it and we can't make it go away. But it is, in children, it is not a good thing. And I think what's important here is you know, there are things that you can control. So you can talk to your kids about pornography and what it is. You can talk about how that is not the real world. It's a fantasy world. Those are not real and loving and meaningful relationships between adults, and that's not what sex really looks like. You can limit their access to it. So there are good parental control blockers. Certainly when they're in your home, you can do things to make that a safer environment. You can talk to your kids about consent and what consent means. You can talk to them that when someone says no, that's what that means, and things have to stop. Equally, you can tell your kids that they have agency and that they are allowed to say no to things, and they are allowed to decide that they don't want to do things. You can, for the older kids that you know are starting to have sexual experiences and mature, you can make those safer. So you can talk about contraception and safe sex. You can talk about sexually transmitted infections. If you don't want to have that conversation and you'd rather someone like me did it, fine, get them in. And one way that we sometimes do this, and the reason I've mentioned the HPV vaccine at the bottom here, is HPV vaccine is another talk in itself, but it's a vaccine to prevent a virus that causes cervical cancer. And the reason I mention it is that we give it to kids normally between the ages of 11 and 13. And so it's a good reason, if you want them to come to the doctor, to get them through the door. If you want us to have the conversation about these things, it's a routine vaccination that girls and boys ideally should have. And so if you're struggling to find a reason to get them through the door, the HPV vaccine can often be a useful gateway to allowing us to talk to them about their sexual health, whether that's with mum or dad in the room, or more ideally with mum or dad waiting outside, because I think kids are more likely to open up and talk about these things when they don't have one of their parents breathing down their neck. I'm going to move on now to the reason I suspect lots of you are here. Susan sent me some preliminary questions before the talk started, and most of those were on mental health. Kids and their brain development is going on just the way it was when we were their age. So there are a lot of similarities, and I think a lot of kids, they don't want their parents to necessarily tell them how to do things, but they like to hear that their parents went through similar stuff to what they're going. And there will be a lot of similarities. But when I think about my kids and the difference between my upbringing and theirs as expat kids, there's a lot of other factors in the mix which can be a huge challenge for kids out here. So they may, the move may have happened in the teenage years. I think it's one of the most challenging things I see as a doctor is families that are going through a move with adolescent age kids, because it's hugely disruptive to them. And there's the challenge of a new culture, new friends, new school, different environments. In the developing teenage mind, that can be a huge trauma. So there's also the internet that wasn't really there when we were kids. And that adds a whole other sort of element to their social interaction. So a lot of bullying takes place online now, which means you can't really escape from it. Previously, if you were getting bullied at school, at least when you went home at the end of the day, you had this few hours in the evening where the bully couldn't get to you. Now it's 24/7 access. There's the usual teenage hang-ups about appearance and about their sort of their friends and their lives, and social media comparisons are fueling those anxieties in children. There are the academic demands. So I don't know about your school, but certainly my kids' school here, is places high academic expectations on the kids, and that's good. That's one of the reasons that we want our kids to do well here. But it creates a lot of pressure, and certainly a lot more pressure than I think many of us would have experienced in our younger days. And then there are all the other extracurricular activities that we sign them up for, and in the later teenage years, these competitions for college places and university places place incredible demands on the kids, and a lot of their time is filled with doing stuff. And a lot of the kids in Singapore, I find, don't have little windows, little bits of their lives where they can just relax and be kids. So when we talk about mental health in teenagers, what's normal? Because I think a lot of parents think that their teenagers have some sort of mental health issue when they really don't. They're just a teenager. The teenage brain is rapidly developing through adolescence, and the main reason that teenagers behave the way they do, we think, is because of the neural connections that are still developing. So most young people make decisions with a bit of their brain called the amygdala. And the amygdala is the emotional center of the brain. The amygdala makes decisions based on on emotions, on impulse. It's anxious, it's happy, it's sad, it's all those emotions. And that's why a lot of teenagers make what appear to us as adults very impulsive, very sometimes silly decisions, is because they've made this decision in a moment based on an impulse. The adult brain, normally, we hope, is moderated by an area in the brain called the frontal cortex or the prefrontal cortex. And that's the bit of the brain that provides some oversight and some monitoring. It's the bit of our brain that says, hang on, just pause for a minute. Did you really want to say that? Or did you really want to do that thing? And so that connection between the prefrontal cortex and the amygdala is still developing in teenagers. And so I think that's an area where, we have to recognize that there's a real biological difference here. Teenagers are different to us, and something that looks like an idiotic or crazy decision to us might, to them in the moment, have felt perfectly rational. So it is normal for teenagers to want to spend more time with their friends rather than their family. And that can be difficult for us to stomach as parents. We're used to our kids wanting to hang out with us, wanting to play with us, wanting to sit down and have dinner together. And then suddenly they don't want to do those things anymore. That's normal. Doesn't mean that you have to, you have to 100% accept it. You can forge family times, family routines, but there's nothing abnormal about that. Teenagers become less communicative with their parents. They might become more communicative with other people, but they tend to communicate their thoughts and their desires and their wants to us less. They want to rebel and they want to test things and push boundaries. They want to test you. They want to test their teachers. They want to break the rules a little bit. They're often moody and irritable. So far more prolonged emotions than when they were kids. Younger kids will have a tantrum, but they might recover from that very quickly. In a teenager, that mood could last the whole week or the whole month. They often want to go to bed late, and they're often very difficult to move in the morning. And I know with international schools here, when the school day starts very early, that can be a challenge. And we've kind of invented that school day for our own convenience, and it doesn't really fit with a normal teenage day-to-day cycle. And so that can be challenging for them. So all these things are normal. It doesn't mean that they're not an issue and you shouldn't address some of them, but as doctors, we wouldn't call any of these things necessarily a mental health problem. The things that we do talk about when we're thinking mental health are listed on the slide here. That's not exhaustive, but these are probably the four most common ones that patients come to me about with their teenagers, or the ones that we get questions about when we're hosting one of these talks. So I'm going to go through them in order, and I'm going to start at the top of the list with anxiety. The reason being that it's the most common. Almost to the point where some sort of anxiety disorder is expected in our lifetime. So we think around half and probably more of people will go through a period in their life where they suffer from an anxiety disorder. And when we say anxiety disorder, we don't mean just feeling anxious. Feeling anxious is a normal emotion. It's a normal response. It can be a very useful response. It's there for a reason. It becomes an issue when it's more pervasive than that, either in terms of how long it goes on for or how debilitating it is. And when it starts to impact your ability to function, then your anxiety has gone from an emotion to a disorder. And I know that there'll be people watching the talk this morning who are suffering from their own anxiety. It's been exacerbated, particularly amongst young people, by COVID and lockdown. So young people have made the biggest sacrifice in terms of disruption to their lives for the least benefit. So they were very unlikely to ever get seriously sick or die from COVID. It was, these lockdowns have been there to protect older people, but it's young people that have paid with their teenage years. And so that, for a lot of young people, has exacerbated their anxiety. Also the reopening, so going from homeschooling and Zoom and not going out much to being reintroduced to the world for many people, in my experience, was a big driver for their anxiety. If you've been lucky enough to not suffer with an anxiety disorder, the things to look out for in your kids are the physical symptoms of anxiety are often what presents. So the ones listed there are symptoms of panic, pain in the chest, dizziness, shortness of breath, severe headaches. It may be more subtle than that. So it may just be a gradual social withdrawal. It may be heightened self-criticism or self-awareness. But people who are anxious, the feeling becomes all-consuming, and it stops them from performing their day-to-day functions. So you may find that the person who picks up on it is a school teacher. Performance in school may drop, or performance in a sport or in a musical endeavor might drop. So those are the things to look out for. The things, first of all, the things not to say. Anxiety disorder is a horrible thing to experience. It's a very real thing to experience. So trying to make it not a big deal generally doesn't work. That's not what your teenager wants to hear. So telling them to snap out of it, telling them it's all in their head, telling them that the thing that's making them anxious really isn't that important. Those things might all be true, but they're not a solution to dealing with an anxiety disorder. So the first thing I would say to a parent is, acknowledge the problem. You verbalize it to them, tell them that you recognize to it. And if you know what they're going through and you know how they're feeling, say that to them. You don't necessarily have to give them a textbook solution to the problem, and you might not be able to. But some little things that you can try. So trying to help them take back control of their anxiety. So laddering is a technique where you write down a fear ladder. So you write down the things that are making you anxious, and you write them in steps, and you deal with them one step at a time. And that can be incredibly helpful, because a lot of kids who are feeling anxious about a number of different aspects of their life just feel overwhelmed, and actually laying them out in steps can be quite useful. Scheduling worry time. So having 15 or 20 minutes of the day where you can talk about your worries, where you can think about your worries in a controlled way. And then at the end of that, trying to put them back in the box and moving on with the rest of your day, knowing that you'll have that worry time again tomorrow can be a useful exercise. Breathing techniques and mindfulness are incredibly useful for a lot of people. And we have websites, we have apps. I think that there's going to be a fact sheet at the end of the talk, which has some resources on that you can check out online. But those can be useful, and they're often tools that we use in younger people. Grounding techniques that are mentioned there, 5, 4, 3, 2, 1, is a way to try and bring an anxious person just back down to ground, and to reconnect them with their environment and to disconnect them from their anxiety. So 5, 4, 3, 2, 1 is saying to a person, tell me 5 things you can see, 4 things you can hear, 3 things you can smell, 2 things you can taste, 1 thing that you can feel. And that's an exercise that they can go through before an exam or in a moment when they're feeling very anxious, to just try and bring them back down to the ground. For many people, exercise is that grounding experience. If they're running or they're exercising, they're swimming, it gives them a form of meditation where they're allowed to disconnect from the world a little bit. Anxiety and depression are often mentioned together. I think that's because there are connections between the two, and a lot of the treatments that we use to treat anxiety are also used in depression. It's also true that when you've been suffering from anxiety for long enough, it's very hard not to be depressed. I don't see many people with anxiety disorder that don't have some level of mood disorder as well. And again, like anxiety, depression is a manifestation of sadness, which is a normal emotion, which has become such a problem that it has impacted your daily life and your ability to function. Signs to look out for in a teenager. So there is a lot of overlap between depression in adults and younger people, but there are some differences. It can be more subtle, and it can present in different ways. So deterioration in schoolwork, increasingly risky behaviors, changes in appetite, weight, or sleep quality, becoming more socially withdrawn and isolated, not wanting to go out and see friends, or having a very negative view of themselves and the world. These can all be signs of an emerging depression or an emerging mood disorder. In some kids, it manifests as aggression, as rebelliousness. So some kids might lash out when they're feeling depressed. And that can often be counterproductive. It leads to arguments and it leads to confrontation at home, whereas the underlying reason behind that is actually a depression. In its most extreme forms, it can manifest as suicide and self-harm. And there's a little bit in the fact sheet about suicide and self-harm, but I just want to talk about it a little more here. The first thing to say that in a lot of teenagers, there is a difference between suicide and self-harm. So a lot of young people who harm themselves have no intention of killing themselves. And self-harm is often used by young people as a way to release emotions, to deal with emotional pain that they're going through. And in their minds, they don't see, for example, cutting themselves as something that's necessarily going to lead to them killing themselves. But often in our minds as parents, as adults, we associate the two, and that can be pretty scary as a parent. There are self-harm behaviors that are clearly suicidal in nature, and the other thing that we see sometimes in young people, thankfully not too frequently, is suicide, genuine suicide attempts. The list of things to look out for and warning signs here is taken from a list pertaining to adults. So there are some things that are less relevant to young people here. Making funeral arrangements is not one that we see very much in young people, but there are plenty there that are increasingly talking about death, aggressiveness and irritability, having a very negative view of the self can all be risk factors. Possessing lethal means, people often ask what that means. That means that someone has access to a way that they could commit suicide, whether that's a car or a high bridge or a sharp object. And so in people who we really are concerned about their suicide risk, denying them access to the lethal means can be an important thing that we do. I think it should go without saying that if you're worried on this level about your child, then you should absolutely not be trying to deal with this on your own in isolation. I don't think any of us as a parent have the means and the skills to deal with a young person who is considering suicide. And this would always be something where we would take a very multidisciplinary approach to dealing with that, with doctors, with psychologists and psychiatrists, with the school, with parents, with other family members. And so, this is one that really, you should be asking for help very quickly if this situation arises. But there are things that you as a parent can do. I think keeping your emotions in check is really important. Seeing a young person that you love very much, that you've provided for, that you've given an amazing life to, feeling depressed about it or feeling suicidal about it can be very upsetting and very offensive to a parent. Why do you feel like this when we've given everything for you and we've done everything for you? Keeping your emotions in check is really important. Certainly not dismissing or downplaying it. So, some self-harm is attention seeking, but that should certainly not be your starting permission. Oh, you're just doing this for attention. It's not a big deal. You don't really mean it. Listen to what your child is trying to tell you. Ask them why they're feeling this way, why they're doing this to themselves, and don't be scared to ask direct questions. And so we're often told by parents that, I don't want to talk about suicide because I don't want to put that idea in their head. You know, this idea that if you ask someone if they're thinking of killing themselves, they might say, well, I wasn't, but now that you've put the thought in my head, I'm going to go and do it. This has been researched and researched and researched. It does not happen. People don't commit suicide because a doctor or a friend or a parent gave them the idea to do it. So you can ask someone about this in very explicit and direct terms, and that can be incredibly helpful, both for you to get information as to how bad things are, and for your child to be able to get something off their chest that they didn't think they were able to talk about. Finding time to talk about this stuff is often challenging. You know, kids don't respond well to a one-to-one, face-to-face, in a quiet room interrogation. And so finding times, you know, maybe it would be if you were going for a run with them. Maybe it would be a great one is if you're driving them somewhere, you're in the car, the radio's on in the background, there's no eye contact because you're looking at the road, but your teenager is sat next to you and you're in an enclosed space, so there's nowhere else they can go. And that's often a great time to broach some of these subjects and just say, how are you doing? How are you feeling? Is everything okay right now? And then letting them take the lead on that. If you can't manage it yourself, there is professional support. In extreme situations, in the middle of the night, there is the Institute for Mental Health, there are emergency departments, there is the Samaritans of Singapore hotline. In the cold light of day, there is your friendly GP, your friends, other family members if you have them here. So don't feel that you have to go it alone. But there are things that you can do as a parent to get the ball rolling. We talked a little bit about suicide, but just to touch on self-harm as well. In most young people, this is a manifestation of an anxiety or a depression, and there is no suicidal suicidal intent at all. The most common modes of self-harm are cutting the skin or picking at the skin, and that can often be scarring and can often cause a lot of distress in later life. And in most young people, it's a primitive coping mechanism to deal with emotions that they're not able to process in other ways. And so, you know, giving them access to professional help and allowing us to show them ways to deal with those emotions in a more healthy way is the best way to approach this. If you have a young person that's harming themselves and you're wondering what you can do about it, first of all, as with suicide, talk about it. You can reduce their access to the means of self-harm. If they're cutting themselves with a knife, try and deny them access to knives. Listen to their experience, talk about their lives and what's going on. If you don't know what to do, tell them. Say, look, I'm completely lost here. I don't know what to say to you, but there is help out there and we'll go and find that help together. That can be incredibly empowering for a young person actually who feels like they're worthless or they're useless, to have a responsible adult say to them, look, you're not, I don't know how to deal with this either. That can be the first step to them finding a way to seek the right help. And you don't have to offer too much advice. You don't have to say, well, if you just did this, or, you know, I had a friend and they did that and then everything was fine. You know, everyone's different, and you don't have to provide them with a textbook for life and a solution to all of their problems all in one go. Eating disorders, the reason this you know comes after the self-harm topic is that there is a little bit of overlap between those two areas. Eating disorders are one area of mental health which is increasing quite a bit in young people. They've always been an issue, but the incidence seems to be increasing, and the type of eating disorder that we see has changed as well. We don't fully understand why eating disorders happen, but it's an interplay of a number of different factors. Certainly there are cultural factors. There are social factors between young people, and there does appear to be some genetic predisposition. So we do see eating disorders run in families, but it's difficult to tease out whether that's environmental or genetic. Probably a bit of both, in my opinion. Eating disorders are often born out of a low self-esteem and a dissatisfaction with one's own body, which is heightened in the age of social media. We're constantly bombarded with the ideal life, the ideal body, the ideal figure. And that's hard enough for adults. It can be incredibly challenging for teenagers. We have seen a shift. When I was a teenager, and certainly when I was at medical school, anorexia was the most widely acknowledged and recognized eating disorder, even though it wasn't the most common. And the thin ideal of the 80s and 90s, the sort of the Kate Moss supermodel era, drove a lot of that. We still see a lot of anorexia, both in teenagers and adults. But by far the most common eating disorder is bulimia and binge eating disorder, which is sort of a little bit like anorexia, but without the extremes of weight loss. So it can be much harder to spot as a parent. If a young person has full-blown anorexia, you can't miss it. Bulimia is much more insidious and easier to hide. For those who don't know, bulimia is an eating disorder which basically involves binge eating or overeating and then deliberate purging and vomiting to avoid gaining weight on the back of that. The other big one that we're seeing a lot of at the moment is something called orthorexia. And this is, a big thing in the social media age. Orthorexia is an unhealthy obsession with healthy eating, with not necessarily weight loss, but with clean eating, with going to the gym, with following a certain body ideal. It's one that we see in boys a lot these days. This idea of needing to have very big muscles and very low body fat, and an obsession with diet and health without necessarily being an obsession with weight loss. And those are things to look out for as a parent. Is your young one? I mean, we all want our kids to eat healthy and to exercise regularly, but that can be taken to extremes in some cases. Sadly, eating disorders they carry the highest mortality of any mental health disorder. So lots of young people who have an eating disorder, particularly anorexia, will die from that eating disorder, which is a horrible thought. And again, a little bit like suicidal thoughts, this is absolutely one not to deal with on your own. I've never seen a young person with an eating disorder and not referred them for further help. I've never, even as a doctor, I wouldn't be managing that on my own. There's a slide here with the signs for a parent to look out for, which I think is quite nicely done. I think that's an Australian slide. But the thing to say about eating disorders is don't try and deal with them on your own and act early. So we can achieve a lot more the sooner we get a young person to see us and get them some help. The longer you leave it for them to access care, the harder it's going to be to manage. So what do I do all day? I talk about young people that I see and come and see us if this happens, come and see if that happens. What does a GP actually do? Well, we explain on this slide. We first of all, we're just someone different. We're not their mum or dad, which sometimes is all it takes to get a young person to open up. Some teenagers, a lot of teenagers just don't want to talk to their parents. We can provide a confidential environment. And I think it's important to explain to your teenager that they can go and see the doctor and they can tell the doctor things and the doctor will keep those things confidential. I think it's also important for teenagers and actually all people to understand that confidentiality isn't an absolute right. It isn't absolute in any circumstances. If we think someone is in imminent danger, if we think that a serious crime is committed or about to be committed against someone, we can break confidentiality. But the chances of that happening and the times in my life that has ever become an issue are tiny. And I think the general principle that we should be communicating to our young people is they can come and see the doctor and they can trust that person not to break their confidentiality. Sometimes we can exclude physical causes for the symptoms they're going through. They might be losing weight because they're depressed, but we might do some tests to make sure that they're not losing weight for some other reason. We can give them a diagnosis. Sometimes a label can be helpful. Sometimes being told, look, you're not imagining this, you are depressed, and here's what we can do to help you about it. We can help with that. We can assess their risk. If you're really worried about them being a danger to themselves or other, we can assess that for you and give you an idea as to how bad things are. We can make a plan. Sometimes that plan doesn't involve me. It involves sending you to see a counselor or a psychologist or a psychiatrist, or a dietitian or a school counselor. But we can try together to come up with a plan to help them fix this. Sometimes we prescribe medication. I have to say, not very often. I can probably count on one hand the amount of teenagers in Singapore that I'm currently prescribing medication for depression or anxiety for, but we can, and sometimes it's incredibly helpful. So, we don't rule anything out. And sometimes we can just signpost you to resources. Sometimes we can say, look, there's this really good course online that you can do. Here's the link. I'll give you access to it. Go away and do this. Come back in a week's time and tell me how it went. So sometimes, in Singapore, in a private health system, people have difficulty navigating that. Who do I see? Where do I go? Who do I call? So sometimes as GPs, we're signposters to the next step in the journey. So I've been talking to you all for a very long time now. I'm fed up with the sound of my own voice. So I hope, Susan, that we've got some questions now and that we can open it up to the floor.
Yes, we do have some questions. So we just kind of rewind to the physical subject where we were talking about vaping and all that. So there's a question from Andrea, and Andrea is asking if vaping is addictive.
That's a good question. Yes and no. So it depends on what you're vaping. So for those that don't know, an e-cigarette or a vaping device is basically a way of creating and flavoring water vapor, which is then breathed in like a cigarette and exhaled from the lungs. Some of those ingredients can contain nicotine, which is addictive. Not all of them do. So a vape doesn't necessarily have to contain nicotine, but the ones that do can create a nicotine addiction in the same way that a cigarette can. And actually, in many countries, we use vaping as a way of delivering a controlled nicotine dose to help people quit cigarettes. So someone can get the same nicotine hit that they do from a cigarette from a vape, but not in all cases. So yes and no. Some vaping can be addictive. That's on the physical addiction front. Certainly the habitual addiction of vaping is the same as smoking. So some people become not physiologically addicted, but habitually addicted to wanting to vape.
And obviously also it affects your brain development, right? Like the more you vape, the more dangerous it is. But how do you rehabilitate yourself from vaping or smoking cigarettes? Would the patch help, or how do you would you prescribe medicine for it?
You can do, yeah. So again, if nicotine is involved, there are medical solutions to that. There are nicotine replacements, whether it's patches or gums or whatever. Some people would consider e-cigarettes a nicotine replacement device, but that's not available in Singapore. There are also medicines that we use to treat the addiction, to treat the cravings. Sadly, we wouldn't really be able to use those in younger people. They're not licensed in the under 16s, but there are medical treatments to help you get off that addiction. Sometimes it requires behavioral and emotional support. So there are psychological therapies, hypnosis, cognitive behavioral therapy, which can help people overcome addictions to many things. So yeah, it's not just a case of you have to quit and that's it, and no one's going to help you. You just got to throw them all in the bin and get on with it. You know, if there is a true addiction there, then ask for help. But I think in the case of most young people who are vaping in Singapore, they'd be vaping infrequently enough and with a low enough nicotine content that physically quitting wouldn't be the problem. Convincing them to do so, that it's a bad idea and that it's against the law is the challenge, not necessarily the fact that they can't function without a vape.
Right. Okay. Another question about the HPV.
Yeah.
Can it be given to older teens? So if the child is already 18 years old, can
Yes.
they still have the vaccine?
Absolutely. Absolutely. So the reason that we give the HPV vaccine at the age that we do is that ideally HPV is transmitted through sexual contact. And so you want to vaccinate kids before they've had sex. So doing that at a younger age is a way of achieving that. It's also true that in many countries, a tetanus vaccine is given between the ages of 11 and 13. So for example, in Australia, where that dose is given in schools, it's just convenient to give those two vaccines at the same time in a government program. It saves money, it saves time. But that doesn't mean that you can't give the HPV vaccine to older kids and adults. The HPV vaccine contains 9 different strains of HPV. So it's highly unlikely that at 18 years old, even if you're sexually active, that you've been exposed to all 9 strains already. Highly unlikely. So there is still some benefit there to getting the vaccine. So I absolutely encourage older teenagers and even people in their early 20s to consider getting the vaccine.
Right. And it's 1 dose or 2 dose?
2 dose. Another reason for doing it in younger kids. So if you do it under the age of 15, it's 2 doses. Once you're over 15, it's 3 doses. So you save yourself a dose by doing it in younger people. Another good reason to try and aim to get it done before the age of 15.
Right. Okay. That's good advice. Here's an anonymous question. What about, I love this, you are the GP, but you're also / psychiatrist and therapist for us. So this is a very interesting question for you. What about sexual preferences these days? Is it a phase, being gay, bi, and all the other things that are sexual preference these days?
Sorry, is the question, are those things a phase?
Yes.
Generally not, no. Although of course they can be. I think what's interesting, something that I see increasingly in the young people that I come across, is that they have far less binary definitions of their sexuality. So they see the whole thing as a spectrum, and they sit somewhere on that spectrum, and that can change over time. And so, you know, it's not a question of straight or gay anymore, the way that maybe it was in the past. And I think maybe either culturally or just because of our age as parents, we like a label or a pigeonhole, and most kids now just don't care so much about that label. They're them, and their sexuality is what it is, and it's kind of unique to them. It's certainly true that some young people change their mind during adolescence, and they need to know that that's okay. That doesn't necessarily mean that it's a phase, more that just sexuality develops over time, and it can be a little bit more fluid than we like to think. Certainly, it's true. A lot of parents ask me about being transgender, and is that a phase, and how much in a young person who's expressing their desire to change gender, you know, how should we approach that? And that's still something that the medical community at large is having intense debates about in many countries, because it is true that many young people who feel that they are transgender during adolescence turn out to decide that they're not transgender in adulthood, and that actually maybe they were gay and they were coming to terms with that, or maybe it's the other way around. Maybe they thought they were gay and they're actually heading towards deciding that they are transgender. So I think we have to be careful a little bit about deciding, forcing kids to decide too early, to make decisions about their gender or their sexuality at a very young age, because they do change. And that can be incredibly distressing, telling a 13 or 14-year-old, you have to hit the pause button here and just give it some time, because in the moment that's incredibly distressing to them. But I think, it's like some things are permanent and irreversible. And so I think, when we go down the route of puberty blockers and medications to allow people to switch genders, doing that in a young person is challenging and needs to be approached with extreme caution, because kids do go through phases, they do change their mind about stuff, and so we have to be very careful. Does that make sense?
And also, yes, and also just being open about sexuality, right? Talking about it. I know it's quite hard when people are a little bit uncomfortable talking about it, but it has to be talked about, right?
It does. And I think a lot of the problems that you see in people who are struggling with their sexuality it's not the sexuality bit that they're struggling with. That if it was just them and their sexuality, they'd be absolutely fine. It's the being judged. It's the cultural element to it. It's the thinking that it's wrong, or thinking that it's bad, or thinking that they're not normal. That's where young people run into problems, and they do. We know that young people who identify as gay, to use one example, are bullied more, they miss more school, they suffer higher rates of mental health problems, and that's because of the challenges that they and the hurdles that they have to clear to develop as young people. And so, I think creating an environment at home is, you don't have control of everything. We don't control the cultural narrative. We don't control what happens in school all the times, but the home environment is something that we can make an open and accepting space. And that has to be done within the boundaries of your own lives and your own culture. I mean, I mentioned on one of the slides, although I didn't say it, the Dutch approach. And so a lot of parenting experts and psychologists champion the Dutch approach to sexuality and sex education. So basically in Holland, they're very open about this stuff. In schools in particular, it's addressed very, very young, and young people are allowed to explore and to express themselves much more freely than in many other countries. And Holland has lower rates of sexually transmitted infections, teenage pregnancy, sexual bullying than some of its surrounding countries. It is true. And I think there's a lot to be admired about that. But to pretend that we can take the Dutch model and drop that in Singapore or in the UK or in the US isn't necessarily the case. People have different cultural approaches and pressures and dynamics. And so just because one country does it this way and it seems to work well for them doesn't necessarily mean that that's the perfect approach, and we all have to be like that with our kids.
Yeah.
But I do think that it's common, regardless of how you're going to approach this. If your kids don't learn about this stuff from you, they'll learn about it from somewhere else that you don't have control of. And that somewhere else is normally the internet these days, which is not a great place for a young person to be getting their sexual education.
Yeah, that's true. That's very true. Which is the next question, actually. Vanessa is asking, how do we manage and intervene the social media for our children? Like, they're all addicted to their screens. Everyone is sitting like this with their phones. They are very easily influenced by, vaping and over sexualization of women and men. And
Mm.
how her question is, how does one control this? I don't know if you can answer this because this,
Well,
I think,
I think the answer, yeah, there's a bit of it that's unanswerable in that you can't control it 100%. It's there and it's out the back, and that ship's sailed. Social media and the internet is not going away. You can, to a certain degree, control access. So if your kid's younger, you can not buy them a phone. They can't afford one without you. So you have control at the age at which they get a phone. Once they do have a phone and a computer and an iPad and a laptop, it becomes harder. And certainly COVID has changed that with online learning. A lot of kids were given access to a device at a younger age than their parents might have felt comfortable with. But once they do have access in the house, you can still control that a little bit. So I think, no screens in the room after bedtime is a good one. Ideally, no up close screens. I'm not talking TV here. I'm talking phones and tablets. No up close screens in the last hour before bed. That should go for most adults as well. And then parental blockers. So all internet providers now, and the device manufacturers, Apple and Samsung, have very good, password protected parental blockers where you can get a little bit of control about what your kids can and can't access. And then I know the schools are doing a lot of this about educating them to be safe online, and to give them a chance to talk about it. If they're being bullied on social media, that might be harder to spot than if they're being beaten up in school. That's pretty obvious. And so them having an outlet to talk to you about that and to be able to voice their concerns and their feelings is important. I think also having a time, when screens aren't allowed. I think a family dinner, it doesn't take that long to eat dinner. Should we really all be staring at our phones for this? We're all guilty of it sometimes. I'm not preaching here, but there are times where you can show your kids, this come out of the virtual world for a minute, have half an hour where we eat or exercise or do something together where you're in real life.
Yeah. Oh, back to reality.
Yeah, but I think kids, young people are going to spend more of their lives in the virtual world, and so we have to we have to try and accept and manage that rather than just hoping that it's all going to go away. I was talking to a father last week of a young patient who sees me, and he said they were very worried about the amount of computer games his son was playing every evening, playing computer games. And they talked to him about it, and he said, look, I'm on a headset here, I'm with my friends, so he's playing this game. There's a group of 5 of them, they're playing together, they're chatting, they're socializing. Now, I'm not saying that this is as healthy as them going out and throwing a ball around or doing something more physically active, but this was his social outlet. The game wasn't unhealthy. He was interacting with his friends in a positive, healthy way. They were doing missions together. There was some level of attainment and achievement in the game. And so to say that all these things are a bad thing and we have to ban them is just, it's never going to happen.
Yeah, I think just finding the balance, which can be quite hard, but finding the balance for our own family and what works is probably.
And I think modeling good behaviors as well. I mean, if you sit there staring at your screen all day, then where are they getting it from? So I think with all these things, I think, and that's where when I talk about being in control of your emotions, if you've got a teenager that's screaming at you aggressively, screaming back at them aggressively is probably not going to achieve very much. So just by modeling appropriate behaviors in all the aspects that we've talked about, whether it's healthy eating or screen time or your approach to sexual relationships, our kids need to learn the right things from us in the first place.
That's a very good tip. Okay, let's talk about anxiety. Stephen is asking, is medication appropriate or recommended for extreme anxiety, parenthesis disorder in teenagers?
It can be. I'd say that on average, we probably use it less frequently than we would in adults, but it absolutely has its place. I think the most useful thing I find about medication for anxiety when I do use it, and the more extreme your anxiety is, the more helpful medication is likely to be. So when we see someone, we're trying to assess how bad things are, how severe things are. But the thing I like about medication in some circumstances is it allows you to do all the other stuff that we talk about that helps with anxiety, the real longer term stuff. It might help someone be able to go out and socially interact more, or to exercise more, or to see a therapist and talk about how they're feeling. It can be an enabler of those things, as well as a treatment in itself, and it can be incredibly effective. I think people don't like to, the medication for mental health problems carries a taboo. It's seen as an unnatural thing to do, and you're doing something that affects your brain in an unnatural way. And the truth is that for a lot of people it works. You just need to use it in the right way and in the right circumstances. And I think I would say, for me personally as a doctor, on average, I work harder at trying to find other solutions for younger people than I would for an adult. Because I think in an adult, I'm more able to put more of the choice onto them around medication. Whereas I think in teenagers, we're making a big chunk of this decision on their behalf. And so I think I'm a bit more cautious in my approach.
Okay. And what do we do with the teenager that definitely doesn't want to listen, don't want to see Dr. Neil? I don't need any help. How do you get them to your to your clinic? How do we get them there?
Listen, it can be really, really difficult. Sometimes it takes more than one attempt. Sometimes it takes a little bit of a ruse. You're going to go in to get your vaccine, or you're going to go into, he wants to take a look at that rash on your arm or something like that. But I have to say that those are less successful approaches. If a teenager feels like they're being ambushed, they are less likely to open up. I think a healthy approach, if you can manage it, would be something along the lines of, I know you don't want to talk to me about this stuff. I've arranged for you to go and see this doctor. I've given him some background. It's completely confidential. He's not going to tell anyone else. Go and sort of, sit in the room without me there, breathing down your neck or watching over your shoulder, and just have an open conversation. That if we can do it that way, and the teenager knows coming into the room that they're here to talk about this stuff, you're generally going to be more successful. Because ultimately, I can't pin a teenager down and force them to talk to me, much as we would all like to sometimes. They are in control of their own minds and their own bodies.
Yeah, definitely. And this is going to be my last question, because I know you're very busy and you have to see patients today. What is your advice for parents, or for the friends of parents, or the rest of the family, if the teenagers are dealing with, so much pressure, like their pressure on school, their pressure on social, being social, and family pressures if they're going through a hard time with their family? What can you advise me as a friend of the teenager? And also, what can you advise the parent of the teenager themselves on what to do and how for them to deal with it?
I think, first of all, if you can remove some of that pressure, remove it. If the reason that they're suffering is because of the demands that you and their school are placing on them, then you really got to rethink whether those demands are a sensible approach. it might be that they need to quit one of their extracurricular activities to give themselves a little bit more time. It might be that they need to not go for every possible thing at school that they're going for right now. So some things, some pressures you can just take away, but there will be some that you can't, that are just part of life. And so that's where, the techniques that we talked about, whether it's laddering or grounding or mindfulness, giving them, showing them and teaching them a way to have a release valve on that pressure. When I'm feeling stressed, I like to go for a run or listen to a podcast or meditate for half an hour, and giving them the time and the means to do that. Because there will be pressures that are just part of life, and learning to cope with those is part of developing from a child into an adult. So I think, but I do think that I see a lot of young people here with, impossible demands being placed on them. I think that I went to an academic school and went to university and studied medicine and blah blah blah, and I had it tough and I had pressures. I mean, nothing like what I see in Singapore. So I think, we sometimes parents need a dose of realism as well as the kids. I think
Yes.
we can be a bit kinder to each other on that front.
Yes. And with that note, I have to say thank you, Dr. Neil, for joining us this morning. It was very, very interesting talk. A lot of people still have questions, but we will be here till 3 o'clock answering those questions. So what I'm going to do is I'm going to send them over to you. And when you have time,
Sure.
please email them back to us. There's going to be a fact sheet for everybody. So we will send that off after the talk as well. We'll also share the recording for everyone in case, someone wants to rewind or rewatch the whole talk. Thank you so much for joining us this morning.
Thank you.
Thank you. I'm looking forward to our next talk, when that may be, hopefully in the very near future.
Okay. Have a good weekend, everyone. Take care.
Thank you. You too. Thanks, everybody. Bye.